Hello everyone, how are you? Welcome to the physioBRAIN channel. This is Professor Adriano and today we're going to talk about hip prosthesis, specifically what I can't do after having a hip replacement. And don't forget, go ahead and subscribe to the channel, like the video, and share it with anyone you think needs to know this information. After all, what is it that I can't do after having a hip replacement? This post-surgery period is extremely important, especially after hip replacement surgery, particularly total hip arthroplasty or THA, when a part of the bone is replaced and a prosthesis is inserted. It's essential that in the first 2 months, 3 precautions are very carefully observed, right? These 3 precautions need to be very well managed by the person who had the surgery, by the patient, and also by their family members, because there are 3 movements that must be avoided. We'll talk about what they are in a moment, but first let's discuss why they should be avoided. These movements can lead to loss of protection, to a displacement of the prosthesis, and that causes trauma. It causes a huge problem, right? If the prosthesis that was placed gets displaced due to some mechanical movement, a fall or something like that, it causes enormous harm, right? There's even the possibility of needing to undergo another surgery, right? The risk is extremely high, right? So we have to be very careful with these 3 movements that we must not do, okay? The first movement is what we call hip flexion above 90 degrees. So if I'm sitting, I can't lift it above this angle, I can't force the hip from the knee upward, bend it beyond 90 degrees, bend it past this angle, which is what usually happens when we sit, okay? Because this can cause the prosthesis to become dislocated in the joint, and that's terrible, all right? So I'm not gonna bend my hip upward in this situation. But there's another point. Besides not bending my hip, I also can't bend my torso forward. If I bend my torso forward, I'll be simulating the same movement, I'll be reducing the angle in the same way, and this can also cause the prosthesis to become dislocated there. So don't bend your hip too far upward, nor bring your torso too far downward. Ideally, you should always keep it as straight and extended backward as possible, okay? So pay close attention when you want to tie or untie, put on or take off a shoe or sneaker, for example, right? Be very careful when taking a shower. Trying to wash yourself, this really requires a lot of attention. Don't sit on very low chairs, and don't sit on sofas or beds that are too low or that sink in, right? Like for example, sofas that are softer, let's say, and you sit down and the sofa kind of hugs you, right? So we really need to be careful about that. So don't bend too much or lower yourself too much, all right? Okay, the second precaution is don't cross your legs. For the operated leg, during these first 2 months, don't even cross the non-operated leg. You can't bend, you can't cross your legs, okay? So the operated leg can't cross what we call the midline, right? If we make this movement, the adduction of our leg crossing over here or crossing the leg, it's a terrible, terrible movement that can cause the prosthesis to dislocate up there, okay? So you also can't cross your legs. So that's the second movement that should be avoided, especially during the first 2 months after surgery. And the third movement that we should avoid, that we must not do, especially in these first 2 months after a hip prosthesis, is rotating the foot inward. So I can't make the movement of turning the foot inward, okay? Even the outward movement, we shouldn't overdo it either. We can do it as a therapeutic practice, right? If a physical therapist recommends it, but the inward rotation movement should be avoided, okay? So let's remember, excessively bending the hip is not allowed. It's out of the question. Crossing your legs, okay? You can cross your leg past the midline, you can put one leg over the other, and you can't rotate your foot inward, because these 3 movements can cause the prosthesis to dislocate, and that would be terrible. None of us wants that to happen, right? I hope the video was helpful. If you liked the video or if you have any questions, leave a comment here, tell us how it went, like the video, and share it with anyone you think needs this information. I hope I was able to help. Take care, and I'll see you in the next videos.